Welcome to Supporting the Labor Market Participation of Millennial Young Adults with Chronic Episodic Health Conditions. We're glad you're here. My name is Angie Hunt, Project Manager with the Work Wellness and Disability Prevention Institute, and I'll be moderating the webinar today. This webinar is made possible through the support of the Community Gaming Grant Program through the BC Government, as well as donations and memberships to WWDPI. We thank our program partners, Education Advisory Committee, and speakers who contribute to this webinar series. While we're waiting for others to join us, I'll go over a few technical points for the webinar. You should be able to hear the presentation through your computer speakers or through the conference call line if you dialed in. Please use the question box to submit any issues you may be experiencing and to ask any questions you have related to the presentation. We will collect questions submitted throughout the presentation and follow the presentation with a Q&A based on the questions submitted. Following the webinar, any questions not answered in the allotted time will be answered and distributed after the event. The presentation will be recorded and posted for free on our website within a week along with the slides. You'll be emailed the direct links for all these items when they are available. As I mentioned, my name is Angie and I'll be moderating the webinar and Q&A session. Our presenter today is Arif Jetha. Dr. Arif Jetha is an associate scientist at the Institute for Work and Health. He's also an assistant professor at the University of Toronto's Dalla School of Public Health. Dr. Jetha's emerging program of research aims at understanding the life course differences in the employment participation of people living with chronic disabling conditions. He is specifically interested in understanding early labor market experiences and their impact on key transitions across life. His research takes a systems perspective to understand the role of policy-level factors and organizational conditions in the prevention and management of work disability. And now I'll hand it over to Arif.
Great. Thank you so much, Angie, and good afternoon, everyone attending this webinar. And so I'm really excited to be presenting on some of the research I've been conducting over the last few years, which aims at understanding and supporting the labor market participation of millennial young adults living with chronic, episodic, and disabling health conditions. So as you'll notice in this presentation, much of my work focuses on young people living with rheumatic conditions like arthritis, but I believe it has applicability to a range of other physical and mental health conditions which are both unpredictable and maybe not visible to others. And so I'd like to thank the Work Wellness and Disability Prevention Institute for providing a platform where I can present this research that I've conducted at the Institute for Work and Health. So, before moving forward, I thought I would briefly introduce the Institute for Work and Health for those who are unaware of our research. The Institute for Work and Health, or IWH, is a not-for-profit research organization based in Toronto, Canada. Our objectives are to conduct and share research to protect and improve the health of all working people. And studies we carry out are conducted in two broad domains. The first is the prevention of injury and illness through studies of workplace programs and practices, prevention policies, and the health of workers at a population level. The second is improving the health and recovery of injured workers through research on treatment, return to work, disability prevention and management, and compensation policies. As is illustrated in this presentation, scientists at our research institute use a range of innovative, quantitative, and qualitative methodological approaches to address a range of research questions which touch on these two broad domains of work. Notably, our research is used by a wide variety of stakeholders, including policymakers, workers in workplaces, clinicians in occupational health and safety, as well as disability management professionals, and notably has contributed to a range of policy and programmatic changes. So to begin with, I'm going to highlight some research which clearly indicates that a chronic disease can have a significant impact on labor market participation of Canadians of all ages and requires accommodation at the workplace level. So as a brief snapshot, it's estimated that about 50% of Canadians ages 20 to 64 years old are living with a chronic disease. Some of the most prevalent health conditions or chronic health conditions affecting Canadians include arthritis, high blood pressure, mood disorders, as well as diabetes. Notably, estimates suggest that about 4/5 of Canadians are at risk of developing a chronic condition over their lifetime, and the economic impact can be significant. It's estimated that chronic disease will cost the Canadian economy about $190 billion per year. 65% of those costs are associated with lost productivity, reflecting the impact of a chronic disease on labor market activity. Of concern, the number of Canadians living with chronic disease is estimated to increase by about 14% every year. The expected rise in chronic disease prevalence can be attributed to several factors. First, Canadians are increasingly being exposed to chronic disease-related risk factors, including physical inactivity, poor diet and sleep, as well as tobacco use. Second, the rise in chronic disease can also be attributed to an aging population. It's estimated that about 89% of older adults have at least one chronic condition, and close to half live with more than one chronic condition. Data also indicates that a chronic disease is associated with labor market inactivity. Population estimates produced using the cross-sectional Canadian Community Health Survey have found that close to 7% of people living with chronic disease report not working. Findings from these cross-sectional studies also show that the relationship between chronic disease and not working increases with older age. Also, an analysis of the Canadian Community Health Survey indicates that certain chronic conditions like arthritis, hypertension, heart disease are more likely to be associated with not working when compared to other chronic conditions. What's notable is that most studies examining the relationship between chronic disease and work have been cross-sectional. And as a result, we've not really been able to establish causation regarding how a diagnosis of a chronic disease impacts working. So to address this limitation, we utilized the longitudinal Canadian National Population Health Survey and conducted a dynamic approach to cohort construction. The dynamic approach to cohort construction allowed us to test a path model where all participants were free of a chronic condition at baseline. And then we compared survey participants who were diagnosed with a chronic disease to those without a chronic disease over two subsequent waves of data. Utilizing this path model, we examined the direct and indirect effects of chronic disease diagnosis on work status at time 1 and time 2. And findings from the study were interesting, and this is just a summary of the findings. Findings from our analysis showed that a chronic disease diagnosis resulted in subsequent work loss at time 1, which was 2 years following diagnosis. A chronic disease also resulted in work loss at time 2, which was 4 years following diagnosis. Notably, the time 2 effects of a chronic disease on work status were mediated by changes to work status at time 1. So overall, our study found that a chronic disease diagnosis is associated with immediately leaving the labor market. Those who leave the labor market are more likely to stay out of the labor market for a prolonged period of time. In another study we conducted, we compared the relationship between age and length of sickness absence across a number of commonly reported chronic diseases. Our analysis was conducted using non-work-related compensation claimants from a large US insurer. For all common chronic conditions we examined, the length of sickness absence increased with older age. But regardless of the age group, we found that certain chronic conditions like arthritis, depression, cancer were associated with the longest disability days. So in addition to highlighting the relationship between age and disability length, findings from the study may suggest that certain chronic conditions are associated with greater work disability severity than others. And despite clinical differences across different chronic conditions, there may be common characteristics associated with work disability that we can identify and incorporate into the planning and implementation of workplace policies and programs. That being said, only a small body of research to date has focused on the opportunities to support people with chronic disease within the workplace. Studies that do exist have found that the most needed workplace supports can be categorized broadly into several categories that include scheduling accommodations like flexible work hours, extended medical or drug benefits like coverage for medications that might not be covered through public insurance, ergonomic interventions like sit-stand workstations or specialized keyboards, at-work modifications like changing the way you perform your tasks, a supportive workplace social context like encouraging managerial or coworker social support within a workplace. The provision of these workplace supports by employers can be helpful in fostering employment participation, but it's important to acknowledge that accommodating people with chronic disease is not a one-size-fits-all approach. We found that the types of accommodations that are needed often vary depending on the characteristics of the person and the type of chronic disease they are living with, as well as the characteristics of their job. Interestingly, despite perceived need, studies suggest that people living with different chronic conditions may report actually not utilizing the workplace accommodations and benefits that are available. Colleagues at the Institute for Work and Health recently surveyed middle and older-aged Canadians living with arthritis. Results indicated that about 75% reported needing at least one workplace accommodation to sustain employment, but less than 60% reported actually using an accommodation. Significantly, those who did not access an accommodation were more likely to report a missed workday, reduced work hours, or having more workplace activity limitations, highlighting the role of the workplace in addressing work disability. Also, findings indicated that those who did use more than one workplace accommodation indicated a more severe health condition and also reported more perceived support at work. So the findings from the study have several important implications. The first is that people working with chronic disease may experience barriers to accessing the most needed accommodations, and as a result may not be using them. And a person may only ultimately access an accommodation once their health condition worsens, or the quality of their work deteriorates, rather than taking a preventative approach or protective approach. The work context may play a significant role in whether a person chooses to access accommodation or support. For instance, the supportiveness of a supervisor could dictate whether or not a person chooses to access accommodations. I think what's interesting is that despite the growing numbers of people living and working with chronic disease and the importance of the workplace in supporting employment, studies have found that employers often underestimate the number of their employees who are actually reporting at least one chronic condition. These underestimates could be intensified among younger workers that are often perceived as being the most healthy working cohort. Underestimates could also potentially impact the extent to which employers implement strategies within their organizations that support employees living with different chronic diseases. So another reason for the potential under-acknowledgement of chronic disease within the workplace may be the episodic or invisible characteristics of certain chronic diseases. An invisible condition includes those that have no immediate signs or symptoms, like the use of an assistive device or a visible impairment. A number of chronic conditions could be potentially classified as being invisible, including mental health, chronic pain or fatigue, or diabetes. Also, certain conditions can be characterized as being episodic, which means that a person may experience periods of good health interrupted by periods of illness or disability. These punctuations could vary in severity, length, and predictability. For instance, individuals could experience fluctuations in pain or fatigue, and a result could feel down some days and fine the next. And so having an episodic and or invisible condition could be associated with potentially sporadic work limitations and make employment more unpredictable. They could also create difficulties with disclosure and requesting accommodations at work, as others aren't able to see or understand the condition. And it could create challenges for supervisors or coworkers to understand and leave them wondering how an employee could be fine one day and not fine the next. So through our research, one of the main gaps that we've identified in the literature is that most existing studies on the work experiences and accommodation needs of people with chronic disabling health conditions tend to focus mostly on older or middle-aged workers. As a result, we actually know little about the experience of entering the workforce with a chronic disease or disability. We also know little about whether there's a need for tailored policies and or programs that support labor market activity for young adults living with different chronic diseases or disabilities. One way researchers can begin to understand how work experiences compare or differ at various phases of one's life and career is by taking a life course perspective to their research. Broadly speaking, a life course perspective is a theoretical orientation that considers a person's time of life and context in shaping involvement in social roles and perceptions regarding involvement in those roles. In particular, a life course perspective may consider transitions, which are defined as discrete changes or milestones in one's life, or it may consider trajectories, which are defined as a sequence of linked social states over a longer term. When applied to work and health research, A life course approach can be used to identify potentially sensitive periods where a workplace exposure has a stronger effect on the development of a subsequent outcome than it would at other times of life. Other research, drawing from an industrial gerontological perspective, suggests that age is conceptualized multidimensionally. These dimensions of age can include chronological age, which we commonly collect in surveys as the number of life years; functional age, which refers to the changes in workability over time; psychosocial age, which refers to self and social perceptions of one's age; organizational age, which refers to job tenure or the amount of experience accumulated within the labor market; and lifespan dimensions of age, which may include normative, biological, and historical factors that influence behaviors over time. These dimensions of age can be used to conceptualize the role of time and place when describing transitions and trajectories over the life course. And so the application of a life course perspective has been gaining widespread attention. In a recent World Health Organization report, the authors state, the importance of a life course as a framework is often downplayed as common sense and its promotion as needless. In reality, however, acceptance of this principle has enormous implications on the way an individual's health is considered, for the training of healthcare professionals, and for the way health systems are developed to cater for individuals' health needs. The same can be true in the planning of work disability prevention initiatives within the workplace. So drawing on a life course perspective, we could potentially zoom into phases of the working life course that represent particularly sensitive periods. Specifically, we can use this perspective to understand the experiences of young adults and how they may differ from their older counterparts. So as a background, young adulthood is described as a period of life that tends to span between the ages of 18 to 35 years. This definition often differs from researcher to researcher. During young adulthood, nonetheless, a person tends to transition from educational roles into full-time employment. This transition can occur in a series of non-linear phases, including exiting educational roles and preparing to enter the labor market, finding and beginning paid work, sustaining employment, and moving up within one's job and career. Not surprisingly, employment experiences during this period can set the tone for a person's career trajectory, highlighting its importance. Also notable, millennials, the current generation of young adults, make up a growing proportion of the labor market, but face unique challenges with employment participation. Despite having greater technological literacy and access to education, research indicates that millennials are less likely to be employed in full-time and permanent jobs when compared to previous generations of young adults. The lower likelihood of participating in full-time employment could be attributed to an absence of employment opportunities. It could also be attributed to greater preference among millennial young adults for job mobility or jobs with greater scheduling flexibility or a positive organizational culture. So these challenges in finding full-time, full-year work could be potentially exacerbated by a disability. And so some preliminary data from Statistics Canada indicates that Canadian young adults living with chronic disabling health conditions are less likely to participate in the labor force when compared to their peers without a disability. Young adults with disabilities who are employed are also more likely to report issues at work, such as productivity loss, being denied a promotion, earning less income, being allocated fewer job responsibilities, and having difficulties requesting accommodations when compared to their peers without a disability. So it's clear that having a chronic disease may add to the challenges already faced by young adults. So in addition to these labor market difficulties that I've just briefly highlighted, a lot of research now suggests that young adults with and without disabilities face unique social conditions when compared to other generations. Despite perceptions of being an entitled generation, millennials are more likely to experience a higher cost of living, less wage growth, a greater likelihood of living at home, higher student debt, less opportunities to accrue retirement savings, and rising healthcare costs. The social conditions, in combination with difficulties getting established in the labor market, can be associated with a scarring effect that may persist across the life course for young adults with and without disabilities. So it's clear that supporting the employment participation of young adults, especially those with a chronic disease, has important implications for both health, well-being, and quality of life. So taking into account the introductory slides that I've just highlighted, the second half of this webinar presents some research which aims at answering the following specific research questions. First, what are the labor market experiences of young adults living with a chronic, episodic, or invisible health condition? And how do these experiences differ from middle-aged and older adults living with the same conditions? Second, what types of job accommodations and workplace supports do young adults living with a chronic episodic health condition require to find and sustain employment? Third, are accommodations and workplace supports available for young adults living with chronic or episodic diseases and disability? And to what extent are they accessing them when compared to middle-aged and older adults? So to address these questions, I'll be presenting findings from two separate studies that I've conducted in the last year. The first study is a qualitative one, which involved a life course comparison of the employment and accommodation experiences of young, middle-aged, and older adults living with arthritis. And we've actually published two papers based on this qualitative study, which the references are included at the end of this presentation. So what's important about arthritis is that it's often classified as both an episodic and invisible condition. And as a result, previous research has indicated that people living with arthritis face unique challenges to finding and sustaining employment related to the unpredictability of the condition. But to date, few studies have compared whether the employment experiences of young, middle-aged, and older adults actually differ or are similar. So to further address some of these research gaps, we conducted semi-structured focus groups and interviews with a group of young, middle-aged, and older adults living with different forms of arthritis. Recruitment of this sample was facilitated by a private research services organization. And we also conducted key informant interviews with arthritis community groups to inform all aspects of our study design. As part of interviews and focus groups, we asked about the experiences of working with arthritis, how participants' age and time of life shaped experiences in employment, and we also probed on the experiences of living with arthritis, aging, or career development. Special attention was paid to specific changes one faced in their career, their health, or their social role involvement. And then we also asked about job accommodation and workplace support needs, as well as the availability and utilization of these job accommodation and workplace supports that participants reported as being needed. And so I'm going to focus specifically on the findings of the young adults, and I'll draw some comparisons to some of the middle-aged and older participants in the specific study. So as one could guess, young adults, or the young adult participants in the study, reported that the school-to-work transition was an important period of their lives. Many of the participants talked about the amount of effort that they centered on successfully leaving educational roles and entering the world of work. And having arthritis meant that participants had to place a great deal of time and energy into establishing their career. For instance, Aaron, a young adult working in an administrative role within a university, noted the following: "Being a younger person, it's forced me to be more focused in my career than most of my friends would, which in some ways has been a blessing in disguise. So that's been oddly useful. So while focusing time and energy at this period could be taxing for a young adult like Aaron, it also could enable them to have some early success with employment." But time and energy directed towards employment also meant that young adults had to sacrifice involvement in other roles or pre-vocational experiences that were typical of other young adults. Aaron, who we just heard from, noted that it felt that I had to get used to resigning my life and my dreams to my condition. I could see my friends being able to do a gap year, go off and do other things with their lives and just try things, try internships, and I didn't have that luxury. I needed to just work and make sure my job was steady. So it may be that forfeiting these experiences could have a long-term impact on gaining certain skills that could be important for career growth when compared to their peers without a chronic disease who may have more opportunities to volunteer, take unpaid internships, or attend graduate school. Interestingly, many of the participants we interviewed did not necessarily think that their health condition had a major impact on finding work. However, many indicated their long-term career trajectory could be stunted by their health condition, which they anticipated would eventually worsen or become more unpredictable. Accordingly, many young people desired stable working situations where they had access to job accommodations and benefits that could support their health condition and enable them to sustain working over time. For instance, Anita, a childcare worker, noted that instead of arthritis specifically limiting me now, I sort of feel like I have an expiration date, like I'm tired and sore and stiff when I come home, and I kind of feel like there's only so long I can do this for. So being a young person meant that participants had to consider how changes to their health would ultimately affect their career progression. But in comparison, the experiences of middle-aged and older adults in the world of work tended to differ in the study. Middle-aged and older participants living with arthritis described longer job tenures, more work experiences, and stronger work relationships. In particular, job tenure offered them credibility within their jobs, and that was associated with greater comfort in balancing both their work and their health. In particular, middle-aged participants emphasized that arthritis had a significant impact on other social roles, like parenting or being married, rather than arthritis affecting involvement in work. Meanwhile, the work to retirement transition was most salient for older adults. Older adult participants described that their disease was a normal part of aging and was factored into their decision of whether or not they should retire. So clearly some different situations when comparing young, middle-aged, and older adults living with these health conditions. So next in this qualitative study, we also asked young, middle-aged, and older participants about the types of job accommodations and workplace benefits that they required to sustain employment with arthritis. We also asked about the availability and utilization of accommodations and benefits. And what we found was interesting. We found that young, middle-aged, and older participants all needed similar types of job accommodations. As mentioned earlier in this presentation, these workplace accommodations and supports included scheduling accommodations, extended medical drug benefits, ergonomic adaptations, at-work modifications, adapting roles outside of work, as well as workplace social support. And while the types of accommodations and supports that were needed were similar, our findings showed that participants differed in terms of the availability and utilization of accommodation and support needs. And differences in job accommodation, availability, and utilization were often attributed by participants to organizational age or job tenure, as well as psychosocial dimensions of age. And we'll touch on this in the following slides. So young adults reported that having less organizational age or job tenure and a greater likelihood of working in non-standard jobs, which included part-time or seasonal types of jobs, characterized their early work experiences. These work experiences resulted in less perceived availability of job accommodations and workplace supports, and feeling apprehensive about actually requesting accommodations or supports. For instance, when reflecting on her job as a pizza parlor employee, Courtney noted, "I didn't feel supported. I had to request to not have certain shifts or something. Like at one point, they had me on the dough shifts in the morning, but that means that you're also responsible for unloading the shipments that come in. And there was no accommodation for getting me assistance. I was constantly being told, you're not moving fast enough." So as described by Courtney, being a new worker can be associated with working conditions that may limit the availability or access to job accommodations and supports and have a potential impact on one's ability to perform their job duties and be productive within their careers. Young adults also described that they had arthritis at an age that was perceived by others as being too young. These psychosocial perceptions of age and health held by others affected their decision to formally ask for assistance. For instance, Teresa, a young adult interviewee, reported that, "I think there's always this misconception that people don't get impairments until later in life. And so that can always be something very difficult either to convey to your employer or to your colleagues that maybe think that you're getting special treatment or you're just being a big complainer. There's of course that misconception which can be very difficult and can be a struggle for the person themselves to have to admit that you might need extra accommodations." So being a young person living with a health condition that is invisible and is often and incorrectly believed to only impact older adults may create a situation where a person may feel apprehensive about talking about their condition or asking for help. In comparison to these young adult participants, middle and older age participants indicated older organizational age or job tenure and being employed in the types of jobs like permanent full-time work, where formal workplace resources were more readily available as well as used. More years spent within their organization offered the opportunity to build supportive relationships with their colleagues and supervisors, which was also important. Accordingly, middle and older age participants also described being more likely to utilize the accommodations and workplace supports that they needed. So it's clear that young people entering the labor market with chronic episodic disease place a great deal of time and energy towards finding employment and advancing in their career. At the same time, they may not be receiving the accommodations and benefits that are most needed. So we aimed at elaborating on these findings. In particular, in a larger sample of young adults living with a diverse range of disabling health conditions, we aimed at understanding accommodation needs and frequently reported barriers to accessing accommodations as a person transitions from school to work. Our goal was to inform workplace practices which support young workers with different disabling health conditions. And so to meet these study objectives, we conducted an online survey of young adults living with physical, psychological, and sensory disabilities. In the survey, we asked about the types of workplace supports that were needed to find and sustain employment. In particular, we compared broader groups of workplace supports. In particular, we examined differences in the need for soft accommodations, which we defined as those that don't require any structural changes to the work environment, hard accommodations, those that might require structural changes to the work environment, and extended health coverage, like drug, rehabilitation, and medical services that extend beyond those covered by existing public health care. So, and in addition to that, and drawing from the literature, we also asked about the barriers a young person perceived to accessing the workplace supports that were most needed. To be eligible to participate in the survey, participants had to be a young adult, also living with a disability, and participants also had to be enrolled in school and either preparing for full-time work or employed and looking for work. Participants also had to be within 5 years of completing education and new to the world of work and be able to answer questions on the transition from school to work. So we successfully recruited about 155 participants. And for those who've conducted primary data collection of young adults with disabilities, they can attest that this is actually a fairly large sample despite the smaller sample size. And in terms of sample characteristics, most participants were students at the time of the survey, and 50% were employed and students. 3/4 of those who were working worked in non-standard employment situations like part-time, seasonal, or contract types of jobs. Participants tended to report living with physical, learning, or psychological disabilities, and in many cases, participants actually reported more than one disabling health condition, suggesting that this sample may have had more activity limitations and required more accommodation supports. So in response to our questions on accommodation need or workplace support need, participants reported that the most needed accommodation was actually extended health benefits, and they suggested they required this the most to sustain employment. And this wasn't a surprising finding, given that many had more than one disability and likely required more intensive medical and rehabilitation services to support work and health. Additionally, we found that young people reported greater perceived need for soft accommodations when compared to those that were considered hard. Specific soft accommodations that were most needed included scheduling modifications, support with self-management, and workplace social support. So I think it's important to point out that many of the most needed accommodations don't actually require significant resource or financial investment by an organization, maybe just a bit of creativity on the part of the employers. And this point needs to be underscored. We then asked participants about the perceived barriers they faced to accessing the job accommodations and benefits that were most needed. Interestingly, the most frequently reported barrier was related to the challenges with disclosure. As reflected in the qualitative research described earlier, talking about one's health condition created barriers to accessing the accommodations and benefits that were most needed. And despite some of the most needed accommodations being affordable soft accommodations, participants frequently reported that the potential cost of accommodation was perceived as a barrier to accessibility. Also, many participants indicated that they thought the work that they were conducting could not be accommodated, and they would face a negative response from others if they disclosed their condition or asked for help. Overall, results indicate that young adults with disabilities may enter the labor market perceiving a number of barriers to accessing the supports that they need to sustain employment participation. This could limit their ability to succeed in their early career and affect their career growth across the working life course. So as a brief recap of the overall presentation, I outlined research which indicates that a chronic disease has a potentially significant impact on the labor market participation of Canadians. Notably, the episodic and invisible nature of certain chronic diseases can make labor market participation particularly challenging and pose difficulties in work disability prevention initiatives. I also suggest a person's life and career phase can shape the experience of working with a chronic disease, as well as availability and use of job accommodations and supports. In particular, young adults represent a vulnerable labor market subgroup. A chronic disease can add to the challenges of entering the labor market and accessing the job accommodations and benefits that are most needed. These difficulties have the potential to extend across the working life course. So we can draw some potentially important study implications from these preliminary results. Notably, life course theory offers a particularly valuable framework that provides greater awareness of the role of time and place in research on work and health. Our study highlights the role of organizational age, or job tenure, as well as psychosocial dimensions of age in informing work experiences. These dimensions of age may help to understand differences across young, middle-aged, and older adults in their ability to access workplace support and with regards to confidence in balancing work and health. When applied to millennial young adults, life course theory can be used to describe the experiences of entering the labor market, identify sources of work disability, and facilitate the planning of tailored policies and programs. Data from the studies I present also suggests that there's a need for unique workplace policies and programs to address the potential difficulties faced by young adults when entering the labor market with a chronic disease. These interventions should focus on encouraging the provision and utilization of job accommodations and supports within the workplace, and improve communication channels between young adults with disability and their employers. The implementation of workplace strategies should also account for working conditions at the early career phase, which often can include non-standard employment situations, and these non-standard employment situations may limit the provision of both accommodations and benefits. And as noted in my study findings, many of the most needed accommodations are soft accommodations, and as a result are likely to be inexpensive for employers and easily administered. So greater employer education might be needed to promote the provision of low-cost opportunities that support young people living with different disabling health conditions. So moving forward, there are several potentially important research directions that we can also take. First, we may need to further apply a life course perspective to better understand the transitions across different life phases and to identify a potentially broader range of sensitive periods within the working life course. We need more research comparing the employment participation of young adults with and without disabilities to better understand the experiences of entering the labor market with a chronic disease or disability and to identify opportunities for intervention. More insights are needed on working conditions that may be a source of work disability for young adults with and without different chronic diseases, as well as within diverse workplace settings to better understand the role of non-standard employment situations. We also need to identify opportunities for the implementation of workplace strategies within different sectors and organizations to improve work outcomes for young adults living with different chronic diseases and disabilities. Lastly, expanding on our study of young adults with arthritis, we need to elaborate on the experiences of young adults living with a broader range of physical and mental health conditions that are characterized as both episodic and invisible to inform work disability prevention initiatives that are broadly applicable. So to conclude, I'd like to acknowledge our study teams for both the first and second study that I presented on. as well as several community partners that were involved in study development and implementation, as well as the funders for both studies, which were supported by different participation grants offered by the Social Sciences and Humanities Research Council of Canada. Also, just to flag that the Institute for Work and Health operates with support of the province of Ontario, and the views expressed in this presentation are those of the authors and do not necessarily reflect those of the province of Ontario. And so we'd also like to encourage you to check our institute out on our various platforms where we're quite active. And I've included some of the research that I've cited throughout this presentation at the end of this presentation, and I've been told that it will be shared with the group. So I'd like to thank you all for attending the webinar, and I'd be happy to take any questions now.
Thank you. And to our audience, if you have any questions at this time, please enter them into the question box on the GoToWebinar panel, and we'll ask them out loud. Some questions that came in. On the reporting of the aspects of extended health benefits requested by those in the study, what aspects of the extended health benefits were reported as most needed?
So what we tended to hear the most, especially amongst the young people with arthritis that we talked to, was that oftentimes the drugs that they require to control their health condition and manage the episodic nature of their condition are expensive biologic medications. These medications can be quite expensive and range between $5,000 to $10,000 on a yearly basis. And in some cases, in countries or provinces like Ontario, there might be cases where a person might not have these medications covered by their provincially provided drug benefits. And if they don't have private insurance through an employer, they're left struggling to decide how to find and control their health condition. So what we often heard was that young people were actually finding jobs that specifically had extended medical benefits so that they could get access to these drugs that they knew that were most important. But what that also meant was that they were less likely to experiment with different types of work, maybe move to different types of jobs, which is often characteristic of many other young people. And so they often felt locked into their jobs and unable to move up or move to different organizations because the fear was that they would lose access to pharmaceuticals, rehab services, and other medical benefits that they thought was important to sustaining their health condition and kind of maintaining their quality of life.
Is the research available in a publication?
Yes. So included in the work cited are 2 papers that have been published from the qualitative research. The study that I presented on, or the second study that I presented on, which was a survey, that's currently under review, and we hope to have that hopefully out in the scientific literature in the next few weeks. And so that'll be shared with attendees once this presentation is published online.
Okay, great. I believe that is all the questions for now. Is Dr. Jetha, is there anything you would like to add following your presentation?
No, but I would encourage individuals to come check out the website, and feel free to contact me or any of my colleagues if you have any interest in the work that we're doing, or you want to learn more about some of the upcoming studies that we're conducting on young people living with different health conditions, because we do have some research in the pipeline, and we're always looking for insights from others as well as feedback from others on our work. And we often have webinars ourselves that we would love to have people attend, and so feel free to check us out, and we'd be happy to engage with you through our several platforms.
Great. And thank you so much for your presentation.